Hello everyone, my name is Megan Newton, and today Team 1 will be discussing the United States versus South Korea in terms of economic and healthcare implications of COVID-19 response. It is currently July 29th, 2020 at 9:48 p.m. I want to start off with a brief timeline with key dates of each country's response to COVID-19 to give you an idea about the differences in policy and procedure. First off, the United States saw its first confirmed case of novel coronavirus on January 21st. This was a man in Washington state who had just returned from Wuhan, China. President Donald Trump declared a national emergency due to the novel coronavirus on March 13th. This unlocked billions of dollars in federal funding to fight the spread of the virus. On March 26th, the Senate passed the Coronavirus Aid, Relief, and Economic Securities Act, also known as the CARES Act. The CARES Act has provided funding for states, hospitals, and businesses. For instance, all UAB students will receive free COVID-19 testing prior to returning to campus as part of Alabama's use of its funding from the CARES Act. The same day that the CARES Act was passed, the United States became the country with the most COVID-19 cases in the world. On April 16th, the White House began to issue guidelines to reopen the country. However, the United States surpassed 100,000 COVID-19 deaths on May 26th and 2 million overall COVID-19 cases on June 10th. As of July 21st, the U.S. had 3,971,359 confirmed cases and 142,459 deaths. As for South Korea, they recorded their first imported case of COVID-19 on January 21st, the same day as the United States. This was an individual who had just returned from Wuhan, China. The Ministry of Interior and Safety announced on February 3rd that they would be issuing 4.8 billion Korean won in emergency aid. On February 29th, South Korea reached the peak number of daily cases at 909. Now, this doesn't mean 909 cases total. That means 909 new cases added in one day. On March 28th, the number of recovered COVID-19 patients surpassed the number of patients in quarantine or isolated treatment. The KCDC reported a second wave of outbreaks on June 22nd, and as of July 21st, South Korea had 13,879 confirmed cases and 297 deaths. I want to talk more about how COVID-19 has impacted both the U.S. economy and the South Korean economy in different ways. First, I want to talk about gross domestic product, also known as GDP. GDP is the total value of goods produced and services provided in a country during 1 year. As you can see, the forecast GDP growth and the real GDP growth for both the South Korean and United States economies is not the same. This is due to the COVID-19 outbreak. In fact, all of the countries listed noticed a lower real GDP growth than the one that was forecast for their economies before the outbreak. South Korea's forecast GDP growth before COVID-19 was 2.2%, with their real GDP growth being negative 1.8%. The United States forecast GDP growth before COVID-19 was 1.7%, with their real GDP growth being negative 2.8%. COVID-19 has had a huge effect on jobs in the labor market, causing an increase in unemployment. The labor market is the ability of employment and labor in terms of supply and demand, meaning the supply of and the demand for jobs, and the supply of and the demand for workers. Due to the pandemic, unemployment rates have increased significantly. In the U.S., the rate of unemployment has increased by 4.4%, and in South Korea, the unemployment rate has increased by 3.8%. This is due to an increased demand for jobs and an increased supply of workers, but a decreased supply of jobs and a decreased demand for workers due to the COVID-19 pandemic. Many have been laid off or let go due to financial struggles employers have faced in the pandemic, even with increased local and federal funding for businesses specifically. COVID-19 has been reducing a negative externality. With stay-at-home and quarantine orders being issued globally, people have been confined to their homes, reducing commuting and in turn reducing pollution from cars, as well as factories that have had to shut down due to the pandemic. A negative externality is a cost suffered by a third party as a consequence of an economic transaction. In this case, pollution is the negative externality that is being reduced as a result of the COVID-19 pandemic. In simpler terms, if you do not like One Direction, but their music is heard loudly in your house as a result of your neighbors blasting it on July 23rd on the date of the band's 10-year anniversary, that is considered a negative externality. As you can see in the circled areas, pollution in the Korean Peninsula decreased from 2019 to 2020. The pandemic has been present in all of 2020 so far, as their first case occurred on January 21st. The reduction of pollution has been linked to decreased or stopped production at factories and a significant decrease in commuting as a result of the COVID-19 pandemic and quarantine orders. Here I have circled an area to highlight the decrease of pollution here in the United States from March 2019 to March 2020. As you can see, pollution decreased here in the United States as well in 2020. March is when stay-at-home orders began to roll out, so the difference is not huge. However, it is still noticeable. The negative externality that is pollution decreased due to COVID-19. Insurance is a practice or arrangement by which a company or a government agency provides a guarantee of compensation for specified loss, damage, illness, or death in return for a consumer's payment of a premium. Now, in Korea, it is a national mandate that every Korean citizen be insured either through their employer or by purchasing coverage themselves directly from the National Health Insurance Service, or the NHIS. However, in the United States, of the 330 million individuals that live here, approximately 30 million have no insurance at all. Insurance can come in the form of private insurance, government insurance, or one of the two that's purchased through the employer. Now, due to COVID-19, an estimated 5.3 million individuals have lost their employer-sponsored insurance. This is due to many businesses being forced to close for good during the pandemic. Many individuals do qualify for other forms of insurance in the private sector. However, they can't afford it due to the high premiums, deductibles, and other expenses. Many also make too much money or are right above the cutoff line for the government-issued Medicaid. Now, an oligopoly is a state of limited competition in which a market is shared by a small number of producers or sellers. Uber Eats, DoorDash, Grubhub, and Postmates have an oligopoly right now in the U.S. food delivery competition. This is a very hard market to get into as these delivery giants are the most well-known and most sought after. And, as you can see in the chart, food delivery has been on the rise in 2020 due to the pandemic, with many food establishments offering only takeout or delivery through one of these partners. Consumers only have two options. They have to drive to their restaurant and pick the food up themselves, or they have to have it delivered to them. Many choose to do the latter as to limit potential exposure to COVID-19. In South Korea's food delivery competition, major moves are in the works. Germany's Delivery Hero will be taking over Korea's Woowa Brothers, the largest food delivery app in the country. Currently, Woowa, Yogiyo, and Baotadong maintain a comfortable oligopoly in the food delivery market. However, since Delivery Hero also owns Yogiyo, once the takeover is complete, the oligopoly will be no more and they will have monopolistic control. That is, if the deal makes it through the pandemic. This deal has been in the works since December of 2019, but Now it could take over a year as the pandemic has hit, causing the review of the deal to stall. Supply and demand for testing has been a big issue globally. Supply is the amount of good or service a producer is willing to supply at each price, and demand is the amount of a good or service that consumers are willing and able to purchase at each price. In terms of COVID-19, the amount of tests available is the supply, and the amount of people that need to be tested is the demand. The United States has a population of approximately 330 million people. South Korea has a population of 51.64 million people, approximately. This graph shows daily testing per 1,000 people. The demand for testing in the United States has been far greater than that of South Korea, as they have a much larger population and are far more suffering from COVID-19 symptoms. The United States is second in the world only to China in production of COVID-19 tests. South Korea is third in the world in production of COVID-19 tests. The supply for COVID-19 tests has steadily increased to match the demands of each country. As South Korea's COVID-19 cases decrease, they are now producing and shipping tests to help other countries. Recently, South Korea sent 600,000 COVID-19 tests to the United States on April 14th to increase the United States supply, as their demand steadily increases as well. Earlier, we talked about the distribution of financial aid by both countries. Resource allocation is the distribution of resources to various uses. Both the United States and South Korea have allocated billions of dollars in response to COVID-19. The United States has allocated over $2.884 trillion. The funds have gone to emergency paid sick leave, expanded leave programs, covering the cost of testing for those that are uninsured or low income, unemployment assistance, food aid, small businesses, hospitals, COVID-19 treatment and further prevention, and to each individual state and territory. South Korea has allocated over 220.3 trillion Korean won, which equals approximately $184.2 billion for COVID-19 prevention, treatment, loans and guarantees for businesses, households, companies, employment and social safety, disease control, and digital and green industries. Currency appreciation is the increase in value of a country's currency with respect to a foreign currency. Currency depreciation is the loss in value of a country's currency with respect to a foreign currency. In terms of the Korean won and the US dollar, 1 Korean won is equal to 0.00084 US dollars. In terms of the euro, 1 US dollar equals 0.85 euros, and 1 Korean won is equal to 0.00071 euros. Since the start of April, the exchange rate for the Korean won to US dollar has declined. This is due to the Korean won decreasing in value. However, the US dollar has showed an increase in value starting in the second quarter of 2020. COVID-19 has had a huge impact not only economically, but mentally, emotionally, and physically on all countries over the world. We hope that this presentation has given you a little bit more insight into the United States and South Korea and how COVID-19 has impacted them economically.